Welcome. I am Jill Isaacson, President of Gulfcoast Mental Health Counselors. Gulfcoast Mental Health Counselors is an association that was formed to promote the profession of mental health counseling. We put our members first. We listen to our members and strive to make a difference by advocating on behalf of our profession. It is because we listen that our organization's legislative committee has put together this video about Medicare provider status for licensed mental health counselors. Our organization supports full inclusion for licensed mental health counselors in all segments of the mental health community. We are highly trained professionals who stand ready to treat clients throughout the lifespan. However, we are limited in our ability to serve because we do not have Medicare provider status. This video will educate you on this critical issue facing our profession. Join me as we listen to the legislative committee members explain why the time is now for Medicare provider status for licensed mental health counselors.
The current exclusion of licensed mental health counselors from treating Medicare beneficiaries often results in denial of vital mental health services to those in need. Some clients are fortunate and find a Medicare-eligible provider. Many never receive needed care, resulting in high financial costs and tragically increasing morbidity and mortality among clients with mental health needs. Mental health counselors are well trained and stand ready to treat clients throughout their lifespans. Unfortunately, at this time, mental health counselors are faced with severe limitations related to not being able to participate in providing treatment as a Medicare provider. When Medicare was added into the Social Security Act in 1965, the only mental health clinicians recognized in the law were psychiatrists. Clinical social workers and psychologists were added in 1989, but the mental health counseling profession is relatively new. Whether it was due to our relative professional infancy or a multitude of other factors, we were left out. This is an oversight that must be corrected for the good of the community and for the long-term survival of the mental health counseling profession. Why now? As Floridians, we live in the state with the highest percentage of people over 65 in the nation, and their numbers are growing. Every day, more and more baby boomers are moving to Florida to retire. These people come not only with truckloads of furniture, but with mood disorders, anxiety disorders, somatoform disorders, substance-related disorders, and a host of other mental health problems. And these are problems that we can treat, but we cannot because we cannot bill their primary insured Medicare.
Another factor that makes lack of Medicare provider status critical now is the Affordable Care Act. The passage of the Affordable Care Act is changing the healthcare playing field. A key piece of this law is cost containment and improved outcomes. This legislation encourages the formation of accountable care organizations, which aim to provide seamless, coordinated care. This model, which is being tested in various locations throughout the country, encourages collaboration among healthcare professionals as a way to improve care for patients. This means that our government is encouraging all segments of the healthcare community to talk to each other because doing so saves lives. The research shows that patients who suffer from a well-managed mental health problem are much more compliant with their medical care plan. For example, a diabetic who is also depressed does much better overall when his depression is treated. What we have known for years is now public policy. Yes, this is good news, and as counselors, it makes sense for us to form relationships with physicians. The bad news is, most of the patients of Florida physicians are Medicare beneficiaries. If a counselor does get an appointment with a physician to tell that physician all she can do to help his patients, that counselor must tell the physician that she cannot treat the majority of the patients because she can't bill Medicare. For Florida counselors, this means that job opportunities will dwindle. Medicare scrutiny has increased. This means that healthcare providers are at risk to pay back monies for the slightest infraction of the letter of the law. Because the current law prohibits licensed mental health counselors from treating Medicare beneficiaries unless their care is signed off by a Medicare or TRICARE credentialed physician, more and more agencies just won't hire us. It's too much of a hassle for an already overburdened system.
There is good news. There is a bill in the House, H.R. 3662, and the Senate, S. 562, called the Senior Mental Health Access Improvement Act. These bills amend the Social Security Act to allow LMHCs and LMFTs Medicare Independent Provider status. What is the strategy to make this happen? The American Mental Health Counselors Association, AMCA, is strongly encouraging mental health counselors, interns, and students to write to their legislators, asking for their support of this legislation. AMCA has a template available at their website, which is www.amcha.org. After the midterm elections in November, Congress may consider physician payment reform. As of January 1st, 2014, there was to be a 23% decrease in physician reimbursement. However, at the end of 2013, Congress voted to keep the current fee schedule in place until April 1st, 2014. Then in March, Congress again voted to retain the current fee schedule until spring of 2015. This matters to LMHCs because AMCA has targeted this piece of legislation as the vehicle to attach our Medicare provider status bill. This is why contacting your legislator now is critical. The time is now. Write, email, or meet in person with your legislators and tell them why it is important for LMHCs to have Medicare provider status. As Medicare providers, LMHCs will be able to care for their constituents in underserved areas. Approximately 77 million older Americans live in 3,000 mental health professional shortage areas. 50% of the rural counties have no practicing psychiatrists, psychologists, or social workers. These areas may have mental health counselors who could treat patients but cannot under the current program. If these beneficiaries had easier access to care, they could be treated as outpatients before their illness exacerbates, requiring hospitalization. And we all know that hospitalization is very expensive. Early and available outpatient treatment would go a long way to alleviate the suffering of those our legislators serve. Other federal agencies, including the National Health Services Corps, the Veterans Administration, and TRICARE, all recognize LMHCs as providers. Legislators need to fix the gap in care for their constituents now.